Hey guys, welcome back to Medical Coding with Blue. Okay, today's episode is going to be all about advice for nurses who want to make the transition to medical coding. But first, I wanted to say, don't worry, I will be posting the Quiz Friday after this, and I'm very excited because I did something different this time. So, but I wanted to go ahead and put this one out first, and then we'll get to Quiz Friday after this. So, and of course, I'm going to shoot that separately because I like to keep things organized. All right, so let's go ahead and go to the topic at hand. So, if you are a nurse and you want to make the transition from being a nurse to a medical coder, I've gotten lots of emails about this, and some nurses are saying it's because it's just very physically demanding work, and maybe they just want to make the transition to something that's less physically demanding, or they don't want to have as much interaction with patients. And with medical coding, we have zero contact with patients. So either way, I think it's really good when a nurse transitions over to being a medical coder. However, I will say this first. Sometimes, because I've worked with some nurses who've made the transition from nursing into medical coding, the thing that I see them struggle with the most is taking that nurse hat off and not going into nurse mode when they are going over a document and should be in medical coder mode. And that's where I think the struggle for a lot of nurses who make the transition comes into play. Now, you may think, oh, this won't happen to me. It's very easy to fall back into old habits. And I've seen nurses who will go through documentation and pick up diagnoses that are not even there, because it's like, oh yes, well, the patient has this and this and this, and the doctor documented this, so the patient has this. Yes, I understand, but if it's not documented, it didn't happen. If it's not documented, the patient doesn't have it unless the provider documents it. So this is where having to sort of get out of old habits is going to come into play. But this is where you can play up your strengths as well. The thing with medical coding and providers and not just providers, but employers who see nurses who go from nursing to medical coding, they get very excited because a lot of times nurses can go into clinical documentation improvement, because a lot of times nurses are going to understand what should be there. Okay. Now, medical coders do this, but it takes some training. I mean, we don't have that hands-on training. I mean, we have to learn this stuff on our own. And whereas nurses, you're closely working with the doctors, so you understand, and your relationships with them is a lot more involved so that you can know and see what's going on. Whereas a medical coder who has had no previous background in medical may not know all the things that you know, the little nuances when it comes to documentation. This is another thing that's a positive for nurses that want to go into medical coding. Clinical documentation improvement is very important. The American Health Information Management Association has a specific credential for this. Now, there are two major medical coding associations that are nationally recognized. The one that I'm a member of is the American Health Information Management Association. And then there's the American Academy of Professional Coders. Now, I will be leaving both links down in the description box, so that way you can check them out, and see. Personally, myself, I have been with the American Health Information Management Association for over 10 years. I will always recommend them, but you're free to go with either association, whichever one you feel makes you feel most comfortable. I recommend highly that you look into both of them and see what each offers and what you feel would best serve you. Okay, and of course, if you have any questions, you are free to email me at any time and let me know what's on your mind. Okay, but a lot of positives go into being a nurse turned medical coder. So there's a lot of other things too as well. Having good relationships and good rapport with providers. Sometimes that's just an instant thing with doctors and nurses. It's just very instant. And, if you have on there, well, I used to be a nurse. Well, okay, cool, So they know that they can talk to you, and it's like, okay, you understand what they're saying. So there's that also goes into it. So Having a good rapport with doctors is a learned skill for all of us, and if you're a nurse, you're already a step ahead. So that's the way I look at it. Now, when it comes to finding work after you've gone through getting a certification, whether you go through a HEMA or AAPC, once you get your certification in hand and you're ready to go apply, well, already you have job contacts. You know, I mean, I'm sure you know people in the industry already, whether you're looking at hospitals or whether you're looking at doctor's offices. I'm sure you already have contacts. However, if you don't have contacts, maybe you've moved to a new area and you want to get started as a medical coder, you already have background selecting codes. Most times, most nurses, almost every nurse I've talked to has had experience selecting codes. So they already know how to select codes. So this is something that you have to put on your resume. You have to make sure that you put everything on there that you know. If you know ICD-10, if you know CPT, things like that. You want to make sure HCPCS, you've got to know that you got to put all of that information in there, okay? You may not have experience at being an active medical coder, but you have had experience applying codes, okay? This is obviously going to put you at the head of the pack because obviously you have all this nursing background and you know how to select codes. It's just a matter of getting your first job as a medical coder. Now, I'm not saying that it's you're a shoo-in, okay? Obviously, for some places, you know, it's going to be different. The criteria is different. So it's going to vary from place to place. I'm just thinking that you're going to be at the head of the pack because you used to be a nurse and now you're a medical coder, okay? So there, you already do have some experience. You know, you were the one applying the codes. So, yes. Do I agree that this is a good thing for nurses to go into? Absolutely. Absolutely. Because like I said, you guys have all of this knowledge, you know, and to be able to apply it and in a job that where, you know, you're still in the medical field, but you're not having to have contact with patients and you can just work with providers or other fellow medical coders, coworkers, things like that, you know, I mean, that's always going to be a good thing, okay? So, yes, I do think that would be a good thing for a lot of people that are nurses that want to transition. There are little nuances, and the nuances, like, just the little things, like about procedure coding and evaluation and management coding, those are things that can be learned over time. There's not going to be a lot of things that you're going to be able to pick up right away because these things just take time and practice doing them, as far as like having the time to actually spend and look at what you're doing. A lot of times, like when nurses are just selecting codes, they're just selecting codes that are either like a pre-category, like they already know, like this is the category of codes that we normally use, and so I can pick these. So being able to pick from every specialty in the book is going to take some getting used to because like I said, all specialties have their own little nuances. So, but yes, I think it would be enjoyable for somebody that's already been in the field, that has that sort of background and knowledge already. Not only that, when you're looking at this documentation, you can tell where there's going to be points of improvement, where improvement can be played out at. So being able to bring that to the table is really valuable as well. A lot of times nurses, once they've, you know, gotten their credential in medical coding, they'll get another specialty credential, which the American Health Information Management Association has that specialty credential for clinical documentation improvement. This is a nice little feather to have in your cap, and like I said, it's just so valuable. Every time I go to conference, I meet nurses who become medical coders, who then become clinical documentation improvement specialists, and they spend a lot of time doing lectures at conference as well. That's always going to be an option for you to be able to do something like that, because having that background is really going to help. So that was just my advice on it. I've been in this industry for over a decade. I started with no medical background at all. So I always say people who have medical background are a lot further ahead than I was when I first started. If you are in a age group where you're older and maybe you're in your mid 40s or mid 50s, that's fine. I've known many ladies or many gentlemen who have started out later in life and in their mid 40s, mid 50s, you know, some in their early 60s, okay, when they started out. So can you do this later on in your career? Of course. You know, that's never an issue. Don't ever think of your age as an issue. I get that a lot from people who have no medical background and they still are able to get in it. And I've known people who are, you know, 45, 55, 65, and they're just now starting in it and they've been in it for years. So it's really open to anybody and everybody. So just be sure to look and ask questions. And like I said, if you have any questions, let me know. I've been in it and I've known what it's like. So if you have any questions, I can help you find the answer, or I can give an answer to you. So anyway, I will go ahead and wrap this up. But if you have any questions, please let me know. Like I said, I'm here. And if you are interested in wanting to know about the medical coding profession, I do have a few videos of a day in the life of a medical coder. So just be sure to go through my videos. Now, I am not technologically advanced. However, I am learning how to do playlists, okay? So I already have one playlist going on my channel, so I will start organizing my videos a little bit more so that way you can be able to access these videos a lot more quicker. But anyway, I will go ahead and wrap this up. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, I will see y'all in a few minutes. Bye.